Um, Thank you, Mark, for that wonderful introduction. And it's such an honor to be among this panel of distinguished scientists and people who are as enthusiastic as it gets about LHON. It's a pleasure to tell you a bit more about the first gene therapy trial from NeuroOff at US. This is the NFS 01 clinical trial. Uh, Hopefully you can still hear me okay. Focusing on the ND4 mutation. So just to wake you up a little bit, here are pictures of different optic neuropathies, and the ones are associated with optic nerve swelling is image on top. This could be related to ischemia, abnormal brain pressure, or inflammation. And then there are optic neuropathies associated with thinning of the optic nerve, including a retrograde degeneration from a brain lesion, other optic neuropathies like glaucoma, and then, of course, LHON, which is one of the most important mitochondrial optic neuropathies, a energy failure of a metabolically very active optic nerve. So when we launched this trial in the US, the goal is to make a difference in treatment for these patients. And as you heard from session one, there's a lot of interest. We really couldn't get the treatment soon enough. But of course, there are many, many hurdles that were alluded to by the excellent speakers in the first session. And I appreciate learning and refreshing my memory about many of these things. So in terms of the ND4 gene therapy trial in the US, we recruited patients with vision loss at 6 months to 10 years, age range, adults, and less than equal to greater than 18 and less than 75 with a genetically confirmed mutation. This is an open label study. Only one eye is injected. And the patients are follow up for 52 weeks, pretty aggressively in the beginning, but most prominently for 52 weeks, and then a long-term monitoring for 5 years. The primary endpoint is to evaluate the safety of this gene therapy intravitreal approach at different doses. And I'll talk a little bit about what we've done in terms of the dose escalation in a moment. And the other endpoint is to assess the incidence of adverse events, serious adverse events, and dose-limiting toxicities. Secondary endpoint is to assess the safety at different doses, and there are different endpoints that are listed here. Essentially, there is a fairly comprehensive visual function and structural assessments, and we're looking for a variety of different changes, essentially from baseline to these time points listed. There are important inclusion and exclusion criteria. So the subjects have to have vision loss specifically related to LHON and not other optic neuropathies or vision issues. And the vision loss is typically relatively severe and is at least 6 months from the onset. There are a variety of different things which I'll skip forward, but basically a 5-year follow-up, and the exclusion criteria are probably some of the most important, and we spend a lot of time trying to make sure that the appropriate subjects are recruited into this study. So things like a history of intravitreal drug delivery or surgery are part of the exclusion, history of vitrectomy, previous gene therapy, etc. And they also have to have no other issues, both affecting the eye as well as the brain, that could be impacting the study. I'm going to move forward a little bit, but basically, only LHON optic neuropathy and no other issues that may affect the assessment. It is notable that the subjects do have to stop using idebenone in order to participate in the study. However, there is a generous amount, so as long as they are able to stop the idebenone before treatment, there are usually no contraindications. This is just a short summary of all the different assessments. There is visual acuity, visual field, visual evoked potential, contrast sensitivity, OCT. There's also quality of life measurements. There is a general physical exam, vital signs, EKG, a variety of battery of laboratory testing. I'll move forward, general examination and a detailed blood assessment. So since this is a dose finding study, here are the different doses that are listed. So there is a low dose, and so far we have completed cohort 1, which was treated with the starting dose. And I'll come back to this in a little bit, which is 1.5 times 10 to the 9th vector genome. The high dose is the target and assessment of safety and et cetera. So this is a schedule of what is planned. There is the initial dose you can see on the left side, which is the first cohort in terms of treatment. And after 6 study participants have been treated, we then have convene a safety review committee meeting, and depending on whether there is a safety concern or no safety concern, there is a change in the dose. So no safety concern means we give the green light for dose escalation to the high dose. And if there are safety concerns, then the study would proceed with a lower dose. So essentially, with the second cohort, there's a second safety review, et cetera. Overall, the enrollment is also built in a way that would be as safe as possible for all 3 U.S. sites. So, for example, in any dose group, the second and third subject will be enrolled with a mandatory at least 7 days after the first subject is enrolled. And then subsequent subjects 4, 5, and 6 will be enrolled more than 7 days after the enrollment of second and the third. So these obligatory stops help ensure of the safety of this gene therapy trial. So just a summary of the study timeline and the progress report. The study was launched in 2023, and first cohort recruitment successfully recruited 6 subjects from 3 U.S. sites. The average age is 40 years old, range of 20 to 68 years old age. 2 subjects were female, 4 were male. And again, to remind everyone, this was treated at the initial dose of 1.5 times the 10 to the 9th vector genome. We convened the first safety review committee meeting in October 2023, and based on success of the first 6 subjects, recommended the dose escalation. So currently the study is ongoing at cohort 2, recruitment from 3 U.S. sites treating at the high dose of 4.5 times 10 to the 9th vector genome. So I want to share one slide of the aggregate adverse events for cohort 1. So these are all considered mild. 2 subjects had eye irritation. 1 had a small conjunctival hemorrhage. 1 had COVID, which is an unrelated but still reportable adverse event. 1 had ocular discomfort, and 1 had visual disturbance. So overall, based on the lack of significant issues and no dose limiting problems, we recommended to proceed with cohort 2 at a high dose. So the brief note on the second gene therapy trial from NeuroAuth in the US. This is associated with ND1 mutation. The study is still being launched and it's in preparation. I know at the Stanford site, we have our IRB approved and are rapidly trying to finalize and launch the study. This is also targeting the LHON patient, of course, but with genetically confirmed ND1 3460. There are similar follow-up periods, also open label treatment of one eye. There are 3 US sites and 3 Chinese sites that you heard a little bit about before, and we hope that we could bring you more details on both trials in the future. Thank you so much.